I've been asked to share some latest updates and answers to common COVID-19 vaccine questions, especially in the light of the surge in the Delta variant. This is the second in a two-part video series, so you don't have to watch the first one, but this is the second part. I'm Mary Ann Williams. I'm a nurse practitioner here in Okanogan County, and I've lived and worked here almost all of my professional life. I am an RN as well as a nurse practitioner. I worked in hospitals and in the clinic. I've also been a nursing instructor. I have served on the Washington State Nursing Commission. I've been on the North Valley Hospital Board of Commissioners, and I'm currently on the Okanogan County Board of Health. This is the second part. This is the answers to the common COVID-19 questions. If you missed the first part, you may want to go back and look at COVID-19 in the Delta variant section, which you could look at either one first. So your choice. So the part two, the answers. So the goals for this section: get the latest data on the COVID-19 vaccines and the answers to common vaccine concerns. In January, there was a study done on what are the most common reasons and concerns about the vaccine. So the top 5 answers: the unknown risks for the vaccine. What about the vaccine in pregnancy and breastfeeding? What if I have already had COVID-19, the disease? I think I'll want to wait and see what happens. And I'm concerned about the side effects. So from those, this video attempts to address these main concerns about getting the COVID-19 vaccine. Let's talk about the unknown risks of the vaccine, the wait and see approach, and the side effects. We'll kind of lump those together. Pfizer, as you know, has come out with full FDA approval. That happened just recently on August 23rd of 2021. And so the COVID vaccine is now fully approved with FDA approval for people over 16. And how did they get there? So the FDA reviewed data from 40,000 participants. 20,000 got the real thing and 20,000 got placebo. And they reviewed all the safety data and the known side effects, since it was given to population, people in the general population. So based on all of that data, they have now released that for use throughout the country. So they'll continue to monitor the vaccine safety, and they'll do that just like they have done with any other vaccine, all the other vaccinations that they've done. Moderna and Johnson & Johnson have also vaccines out there that are still under the emergency use authorization, but those are moving swiftly toward full FDA approval as well. So the FDA emergency use authorization versus FDA approval, you might ask, what's the difference? So you can see from this slide that the emergency use authorization, in that case, the production and the testing go on at the same time, allowing the company to manufacture the medication, or in this case, the vaccine, while they are going about the testing. Then after that, and it's proven and they have enough data, then it is allowed for emergency authorization. And so you can see by the blue boxes on the side that emergency authorization is allowed in situations that are emergencies and where there's no other options available. So the main difference is that the production and the testing can happen at the same time, and then the product becomes available faster. For the full FDA approval, you can see on the left-hand side that testing leads to then approval, and then the production, and then the distribution of the medication, or in this case, the vaccine. The approval typically takes about 10 months, and the FDA reviews the data over that time, or even longer, depending. But the Pfizer vaccine was put under priority review, so that process went even faster than you might recall the term warp speed. The key takeaway from this vaccine development and timeline, the speed of the COVID-19 vaccine development was due to reducing administrative bureaucracy, but no safety standards were given up. There was no problems in safety. The safety precautions were all observed. There was no bypassing on any of the safety data. There was no corners cut on safety. Red tape, administrative bureaucracy, there was warp speed in production, but the safety elements were all held in place while the COVID-19 vaccine was manufactured. So the latest on COVID-19 vaccines in the United States, 172.2 million Americans are fully vaccinated. What a huge number. 73.5% of the adults in the United States, that means people over 18 have received at least one dose of the vaccine. 91.7% of the adults in the United States over 65 have received at least one dose, and it's estimated that 96% of all the physicians, the doctors in the United States, have received the COVID-19 vaccine. That is a huge number of vaccinations that have been given so far in the United States. We really have a strong monitoring system for the safety of the vaccines. Not only are the manufacturers, as you might imagine, really interested in it, but there is active surveillance by a V-Safe program, and those of you who've been vaccinated know that you've been given the option to participate in that. So you can be contacted by the CDC to ask about your symptoms. The CDC, the Centers for Disease Control, operates the vaccine adverse events reporting system, which means that any event that happens after a vaccination can be reported. And then there are individual case consults. Also, there are a number of other, the VSD, the Safety Data Link. The VA has a huge database, a warehouse of information that they collect. The FDA has a vaccine surveillance program, and the Department of Defense also has the Defense Medical Surveillance System. So there are a number of systems in place to monitor vaccine safety and reports. So there are federal partners. There's a lot of oversight about vaccine safety, and a lot of eyes looking at the safety and the data of vaccinations. The COVID vaccines have undergone the most intensive safety monitoring in US history. It includes established and new safety monitoring systems that haven't been available for other vaccines. And the results are really reassuring. Serious reactions are rare. Two serious reactions that we do know of are allergic reactions, or anaphylaxis, and blood clots with low platelets after the vaccination, which you may have heard about in the news from the J&J vaccine. It's interesting to note that blood clots are less than 7, that's 7 counted on less than 2 hands worth, per 1 million people vaccinated. And just a word about the anaphylaxis, that's why you wait for 15 minutes after you get that injection to see if that is going to happen. And again, those are extremely rare. And if you, again, those are in all the vaccinations that I've been a part of in Okanagan County, we have seen none of those here. So those are also extremely rare. The vaccine side effects It's normal to feel concerned about possible vaccine side effects. The risks of vaccine side effects, short-term and common, are like headache, fatigue. If you compare those to the real dangers of COVID-19, of actually getting the disease, they're minimal compared to the morbidities that you see of people that are hospitalized with the disease. Many people who've had the virus report long-term symptoms that impact their daily life, which include permanently reduced lung capacity and loss of taste. You don't have to be very aware to know that all the ICUs in this country practically are full because of people that have had the disease and are suffering from the effects. So another concern, we talked about three, another is pregnancy and breastfeeding. The CDC recommends that COVID-19 vaccinations be given to all people 12 years of age and older, which include people who are pregnant, breastfeeding, and or who might get pregnant now or in the future. This is a relatively new recommendation. At first, there was some questions about giving this to pregnant people, but they have come out with a strong recommendation that it be given to pregnant people. Why is COVID-19 vaccination especially important for pregnant people? Because in pregnancy, you're more likely to get severely ill with COVID-19. Again, the rates of unvaccinated pregnant people experiencing severe outcomes with COVID-19 infections are increasing. So vaccination is a way to prevent that. We now have much more safety data on COVID-19 vaccinations and pregnancy, and that data suggests that the benefits of getting the vaccine outweigh any known or potential risks of vaccination during pregnancy. So you can rest assured that the vaccine has been given to people who are pregnant, and there are good safety data surrounding that. There is no evidence that current or future fertility is affected by any of the COVID-19 vaccines. So you can rest assured that doesn't affect the ability to become pregnant if you get the vaccine. And the job of vaccines is to help build antibodies that can protect not only the pregnant person, but the child that is the result of that pregnancy. So just like other protections, this is recommended during pregnancy, and it's good for the pregnant person and their child. So the key takeaway for pregnancy, due to the increased data that we now have about vaccine safety and the high risk of severe disease in pregnant individuals, the CDC now has a recommendation that COVID-19 vaccine be given to all pregnant and breastfeeding individuals and those who are considering pregnancy in the future. This brings us to the next COVID-19 vaccine concern. Actually, this is our last one, and that is, what if I've already had COVID-19, the disease? So I think I might have had that already, so I don't think I need the vaccine. What if I've already had it? So this is the recommendation about that. The CDC recommends vaccination for everybody over 12 years old, even if you've had COVID-19 previously. And here are the rationale for that. Reinfection can occur as early as 3 months after the initial infection. So if you've had COVID-19, you can get it again in 3 months if you haven't had the vaccine. The reinfection rate is more than 2 times as high in unvaccinated people than in vaccinated people. So if you do get the disease, the recommendation is that you still get vaccinated because you're less likely to get the disease again. Partially or fully vaccinated people who get reinfected have much milder symptoms than unvaccinated people. So the key takeaway for people who've had previous disease or COVID-19 infection, new data indicates that people who've already had COVID-19 have some protection against the virus, but reinfection can occur as early as 3 months after the initial Infection, again, remember that viruses mutate, so you could get a mutation. Vaccinated people are much less likely to be reinfected, so you're getting protection against future mutations and protection that lasts longer. Immunity from vaccination provides better protection than immunity from infection, so that's another reason. It's normal to have questions, and you may have more questions after this presentation than you had from the start, although I hope this has answered some of your questions. If you still have questions, and especially about you personally and how it affects you personally, contacting your primary care provider to discuss that is a really good way to find out how it affects you personally. So I would encourage you to make that appointment and to talk to them personally about your personal situation and what their recommendations are for you. This is the end of the part 2. Remember, there is a part 1, the latest updates. So if you haven't already seen that, look for that. And another way to get answers to your questions, again, is to reach out to the Okanagan County Public Health Department, and they have a website. They have a Facebook page. So here are some resources that you can go to for links for real-time data. They update their page daily in terms of the number of people who are getting the infection, the areas of the county that have seen the most, the number of people that are hospitalized, the number of people who are actually getting immunized and where they're. So it's a good source for information. So I would encourage you to take advantage of that. So thank you for listening, and we hope this has been helpful for you.